Everybody, I'm Dr. Alonso with Nuceria Health and Dr. Lemus with our in-house house physicians. And we wanted to kind of talk about ozone therapy today. There's a lot of misconceptions out there. What is ozone? What it's used for? So we're going to kind of get some of the facts out so you get a better understanding what it is. One of the biggest things is oxygen, right? The same way that there's a decline of our overall hormones, vitamins, and nutrients, there's also a decline of our overall oxygenation of our tissue. It can lead to a lot of different illnesses and a lot of different conditions, inflammation, things like multiple sclerosis associated with maybe decline of oxygen. But we're going to kind of run through. First of all, Karen, how do we even make ozone? What's the actual process, how we make ozone?
So we do know that ozone, like we have it in our stratosphere, right? And big machineries, like at big companies, also make ozone. But this is not the type of ozone that we're talking about. We actually have a generator that creates this ozone attached to a medical grade oxygen tank, creating that third molecule of ozone or of oxygen that will reintroduce into your blood. We mix it up. It already has a little bit of anticoagulant in it, and then it goes back into the patient's body. And we've had some remarkable success and really great stories from our patients. Overall, healthy, well-being, better energy, better sleep, less inflammation, let it be on their skin, inside their body, in their joints, in their muscles. There's just a lot of benefits that this type of therapy has offered our patients, and we're really happy to see our patients feeling a whole lot better overall.
One of the other things that comes up a lot too is one of the things that ozone therapy tends to treat. I mean, ozone therapy has been around for 150 years?
Yeah.
In the late 1800s it came about, and it was used to treat wound infections and in the field and during World War I. So it's one of those things that it's been around for a very long time. It's safe in the right hands in the way that we administer it. And again, it's vitally important that you do see someone that knows and is well versed in how to treat with ozone. And we see this as an adjunct to actual other types of therapy. And when other therapies fail, how many patients are resistant to certain types of antibiotics? And we're seeing now with ozone therapy a huge impact with treatments of things like COVID-19 and even Ebola with ozone therapy, and with great success. So again, when other things fail, ozone may be a good adjunct or in place of other treatments in order to gain your overall vitality. Things like stem cells as well, it helps to boost the efficiency of stem cells and other processes in your body. People with heart attacks have had great results with being able to be put on ozone, and helps repair with a lot of tissues. Right, we're seeing a lot of Lyme's disease, right? We have patients with Lyme disease.
Patients with Lyme disease, even patients that have herpes, even HIV. It really reduces a lot of the pathogens that are already living in their body that is not helping them, live a day by day. It has so many benefits versus the cons that I tell patients try it at least once, so right hand, how we're treating you, how the process is done, and like Dr. Alonso says, you want a team of people that are well versed in this field, because not everybody should be doing ozone IV therapy. We try to have our patients do an evaluation with them to make sure that they're the right candidate for this type of therapy, and it goes along with other types of adjunct medications and therapies that we provide to our patients. Everybody is different, and we want to give them the best possible outcomes with this type of therapy.
So if you have any other questions, feel free to reach out to us at Nuceria Health for more information on ozone therapy and all the other types of therapies we have at Nuceria Health. Thank you.